Hello everyone, it's Bridget Mettler here from the Doctor's Technology Office, Doctors of BC. We'll get ourselves started right at 6. We are tired, all of us. It's been a long day, and we've had a few of these in the evenings and a few of them in the early mornings. And as Carol's been saying, we're almost like the webinar queens and kings around lately in this province of how many sessions we've held. If you've just joined us, just hello, and if you could find the Q&A box at the bottom of your screen or the top of your screen and just say hello and where you're from so we know that you've found your way to the right spot. In the question and answer is where we'll be answering a lot of the questions. We'll be theming them up. I'll be helping to try to figure out some of the questions that we can take live and which ones we can answer on the fly. We also have the Doctor's Technology Office team on the line as well, and they'll be helping to live log some of the questions that you might be having as well. If you're having technical difficulties or you need some help, there's the Zoom webinar chat feature. That's for Astrid and Anshel to be able to help you out as well. So welcome to our Doxy Me for virtual visits with our guests today, Dr. David Harison, Dr. Devan Reddy, and Dr. Billy Lane. Thank you for doing this for us. Again, this is, there are many platforms out there. There's Zoom, Live Care, there's a lot of things going on. The doctors in this meeting are showing you yet another version of what they can do with doing virtual visits with their offices. But again, we're not recommending one tool over another. This is not about selling. This is about showing you how you can leverage what you have or different technologies that are out there. We're going to hold the bulk of the questions to the end, but we will take a few as we pause. There'll be some pauses and there'll be a demo as well. And we will share the slides with you and the recording afterwards. So we'll also end right on time, so right at 7, but we will stay on the line. So if you want to have more of a one-on-one or a more in-depth discussion, we'll let everyone else go and then stay on the line. As I said, we are recording this. This is a smaller group today. Believe it or not, this is a smaller group. But the reason we do sometimes smaller sessions is so that we can get a nice clean recording and we can leverage it provincially. There's a lot of interest in these tools and a lot of interest in how to do this. And there's a lot of people with different learning levels or a capacity to be able to join a webinar. So some would like just to have a quick video. So with that, I'd also like to thank our partner programs, the North Shore, Victoria, Fraser, Divisions Family Practice, and all those that help partner with us to leverage these learnings for the provincial level. And some of the smaller groups in the province really appreciate this because they do not have the resources to be able to launch something in their own divisions or in their own areas. So it is really much appreciated by the entire province that you were able to partner with us on this. And shout out to Agata on our team as well for the work that she's done in leveraging a lot of this across the province and making sure those relationships are being utilized. So with that, I'm going to hand it over to Dr. David Harison to get us kicked off and started. And thank you very much for joining us today.
Again, it's my distinct pleasure to be able to be invited to do this presentation for everybody. And again, I sincerely appreciate people taking the time out from their day, their busy day, especially under such circumstances, to come and see this presentation. And also like to thank my co-panelist, Dr. Devan Reddy, and then Dr. Billy Lynn, and of course, Agata, who's behind the scene, was my handler and helped me through this process in terms of presenting this material. So next slide, please. So, Bridget, are you going to be doing the housekeeping or am I?
I think we went through most of that. So
okay.
There is a hand raising function. Everyone is on mute, sorry. Everyone is on mute as the default. If you do want to speak, you need to put your hand up so that we know there's just quite a few people on the line. It'd be quite a bit of background noise if we got everyone off mute at the same time. So then again, that's about it, right, Astrid? Did I miss anything?
Yeah, everything else we covered before, so it's
perfect.
Good.
Okay, thanks.
Next slide. Thanks. So for my personal disclosure, I have no conflicts, but my disclosures are I'm a Victoria community GP. I've been practicing here in this community for 6 years. I'm very med access centric, and I'm a Mac user exclusively. My background is academic and education. I was the past alternate chair for South Island Division Family Practice, and also involved with the SGP as an RA member. I'm a DTO and PSP mentor, and I have a small off-the-desk IT company which has made no profit thus far. So those are all my disclosures. Next slide, please. So the goal of this presentation in general is how to integrate a new piece of software into your practices. So I'm just using the example of Doxy today. And I'm going to give you more of a broad overview on how to integrate software, in this case, again, Doxy into your practice. And so based on my personal trial and error experiences. So I'm not going to be telling you exactly what to do, but I will give you examples of potentially how you may do it. And I'll be going through key steps in terms of how to integrate Doxy into your practice as examples, and then give you some guidance, and again, what I have experienced and some tips and pearls so that you can kind of get beyond some of these trial and error experiences that I had to. And I kind of lied. This presentation will have a couple of demonstrations of product features. I didn't realize that we had that capability when I first made the slides. So there were some demos for your enjoyment. And then DTO has kindly provided online videos and instructions in terms of more in-depth explanation of these features, so you can learn at your own pace. Next slide, please. So the presentation is going to be in 4 steps. So one is always a good conversation to have with yourself and with your practice and your staff. Is telemedicine a good fit for my practice? The second part will be how to integrate Doxy into the practice. And so this is more how to use the software and knowing when to use the software. And the third is going to be pearls on how to successfully do a Doxy appointment from the patient, from the physician, and then also from a workflow and staff perspective. It would be the 4th point. Next slide, please. So is there a need for telemedicine? So when I started doing telemedicine, it was before COVID and what we are experiencing now. So when I looked into doing telemedicine, it basically came down to this point. So telemedicine is a tool for accessibility. It allows your patients to gain access to you. And when I looked through my patient panel, these are some of the reasons and some of the patients that I thought would benefit the most from telemedicine. So my young families who are at home with children find it very difficult to come into my practice. I have people in the employed who are employed, difficult for them to get time off work, or if they do have to take time off work, they're actually losing income to be able to see me. And then people obviously who are isolated. So people with mental health, agoraphobia, people with mobility issue, wheelchair bound, geography. I have patients all over the province, also including the Gulf Islands. I have a lot of snowbirds that live in the States and also in Mexico that I still take care of, even though that they've left Canadian soil. Weather was a perfect example. So early on 2020, we had Snowmageddon. And then of course, as we are right now, so pandemics, COVID-19. So despite all these barriers with telemedicine, my patients can still gain accessibility to me and the care they deserve. The other point that needs to be addressed is ageism. A lot of people don't think telemedicine is appropriate for people who are old or patients and physicians for that matter. But in my experience, I've had patients all the way into their 90s that are still able to use and participate in telemedicine with Doxy. It's a very good program and it's very frictionless for people. My oldest patient was 93, was discharged from hospital post-stroke. And he was interested in terms of how to titrate his blood pressure medication with his family, and he was still able to get online and have his appointment and have a very in-depth discussion. And the last point I would like to make is that every physician, every practice really has to do an analysis of their practice to see if telemedicine works. And for telemedicine, really it's a communication tool. Something that Dr. Reddy brought up was that it really lends to family physicians and their strength as empathic communicators. And telemedicine just allows people gain access to what we have to offer, and where often we are the medicine and we are the healer. And so telemedicine just enables patients to get access to that. So again, so if your practice is more communication based, then it is the tool for you. Next slide, please. So on the technological side, especially with Doxy, again, is it a good fit? So Doxy is a telemedicine platform, and it's actually quite low friction. So it offers, and what I mean by low friction, it is quite an easy software to use for patients. It offers video, both phone and messaging. So 3 different ways of communicating with your patients, and I will demonstrate that soon. It's HIPAA compliant. It's secure, it meets all the standards for security. It does not keep or record any information. That's different than other platforms people can use, like Skype, which does store information. So once the Doxy video appointment is over, no information is stored on their servers. And one thing that needs to be mentioned, it's not an EMR, meaning you don't store notes on Doxy. And it also doesn't do things like e-faxing. So really, it's a platform that's dedicated to video conferencing only. In Doxy, there's 3 different plans. There's the free version of it, and it's an excellent version because it's a cost-free entry into telemedicine, and where you can learn how to use it. And it's a great plan to start and to learn. The other plan is professional, where you have more options and more capabilities. This is the one I really dug into. It allows you to do things like screen share, file sharing, photo capture if you wish, and passcodes for a little bit more protection for your virtual waiting room. And then Clinic is now one I've been starting to use more often because I have a nurse in practice, and it's a great platform, and especially in this environment where my nurse can see a patient and then I can join the conversation later. So those are the three plans. And now I'd like to do a demo just so I can show you some of these different features.
Michelle, can you stop the screen share?
I hope I can
share. I was going to say, and this is where you share your vacation photos again. There we go.
And here we go. So I've got Larry, Mo, and Curly. They're all sitting in here in their waiting room. So this is my view on this side. This is the patient view on this side here. I'll just make sure to turn everybody's mics off here. So on my side, I'm going to start a call with Larry. So this is my view. On this view, you actually can see Larry. Oh, this is Larry. Okay.
Larry looks like Dr. Harison.
I know. There you go. I should have put Curly on. And then on all these views, you can, the best are screen share. So screen share allows me to share whatever I have on my side of Doxy. So I use this to share patients' information like lab tests, imaging results, consults. And so, for example, if I share my screen, and I can show them, for example, like a chest x-ray. So chest x-ray can be shown with my patients. It's an excellent educational tool. It makes the biggest difference between just simply having a phone call and then being able to show people and educate people. So, you know, it's the proverbial, a picture is worth 1,000 words. So the other feature that is very good is file transfer, and I'll explain a little bit later, but with file transfer, you can transfer things like medical notes, lab requisitions, and also x-ray requisitions as well. So that kind of gives you a little bit of an idea in terms of the capability of Doxy. That's a little bit more than just communication by voice alone. So the imaging is absolutely crucial. So there you go. I am done. You can start the presentation again. Thanks.
Michelle, can you bring up our slides again?
And again, the DTO will have excellent examples in terms of what the functions are in much more detail. And next slide, please. So what do you need for Doxy? Really, it's a very flexible platform. It's web-based, so you can use PC, tablets, mobile phones on your side and also on the patient side as well. You do need to have a computer camera, but even if the patient doesn't have a computer camera, you can still do file sharing and you can still screen share with them, so they can still get some visual benefit from the visit. Again, microphones are also essential as well, but one feature I didn't show you is that you can actually message. You can type back and forth, and I do have an aphonic patient that we communicate by Doxy still, and he types in he can hear me, and then he responds by texting me back. So it's a very good system that way. One limitation is you do have to have high-speed internet. Without high-speed internet, experience isn't the same. You can get drop calls, and the audio and the visual can be quite spotty. So it's not appropriate to be doing these on the bus, which some of my patients do. Just again, at home seems to work the best. And with that, location for the physician side and also for the patient side, it's always good to have a quiet and relatively secure area so other people cannot overhear your conversations. But I don't know if you noticed, but I tend to use earbuds or headphones, which helps increase security. So you can actually almost have two people side by side, and it's very secure. And then even side by side, you can't hear other people's conversation. It's quite good.
Dr.
And then the
Harris,
other, yes.
the version that you just showed, that was the professional version, correct?
That is actually the clinic version. So it has a bit of different, you can do your own branding, your own color style and swashes and all that kind of stuff.
And that's the one that allows the file sharing as well.
That's correct. Yeah. So it's the pro and then the clinic are the two that allow both the file sharing and also with the screen sharing features as well. Okay, next slide, please. Thanks. So really, the bottom line with Doxy, any physician that has access to a smartphone because it has a camera and built microphone, and with a reasonable internet connection, you can start telemedicine visits starting today or tomorrow, in fact, because today is closed. Next slide, please. So these are clinical pearls that I like to share with you in terms of how I integrated Doxy into my clinical practice. And these go basic steps in terms of integrating any kind of software as a service into your practice. First and foremost is making sure you engage your staff and engage them early. They're going to be your best asset through this process. So by engaging them early, you'll get buy-in from them, collaboration and understanding of the value of why you want to do telemedicine visit. And it will really come out when you engage them, when they start talking to patients, when they start getting access to your clinic. And as well, by talking to staff, you actually get better insight in terms of how your practice actually works in nuts and bolts, and where you can look for opportunities in terms of integrating Doxy into your practice. The second point, can't stress enough, is practice. So when you're, best way to practice is to use the free version, and then use friends, family, colleagues, patients that are technically, yet you'd feel a little bit more secure that will be able to handle Doxy, but generally most patients will have no problems with it. And again, staff, practice with staff. And the reason for this is when the staff has an understanding in terms of how to use the software, then they can start to be able to, one, be able to advocate for it when patients phone in for appointments. They can always say, like, we also have virtual appointments, as example. They'll be able to advertise for you. And they'll also be your #1 troubleshooter when they're talking to patients trying to get online too. And when you're practice, make sure that you're practicing on different devices. Make sure that you're practicing on Windows, Macs, Androids, phones, mobile devices, and then desktops. Because there are some slight nuances when it comes to troubleshooting with the different platforms. And the most common issue that I find with it is browser settings, and then camera and microphone permissions, but generally they're few and far between. And when in doubt, just make sure that you refresh your browser. It seems to correct most of the issues when it comes to camera and microphone permissions. Next slide, please. Okay. So when engaging with the patient, it's great. It's great that you you know, practice the software, you know how to use it in and out, but it's going to be not worth very much if patients don't use it. So so these are the ways that I found that worked in terms of engaging my patients and letting patients know that I even have virtual appointments using Doxy. So before COVID-19 and pandemics, posters were a great way of doing it. I put this on the front door as a possibility, just in case your clinic is closed and a patient does come to your office looking for you, at least they're now informed that you have video visits. Again, on the phone, staff can advertise your service and answer, and putting it on your answering machine. So I've taken a page from our pharmacist colleagues, and right off the bat, we have a message that says, do you know we have virtual visits? Please visit drdavidharrison.ca. And that was really good in terms of getting patients to deliver traffic to my website and then onto my virtual visits. On emails, or on the footers of all of our emails, and we use MailChimp for no reply mass communication with my patients. And this is the primary way that we introduced video visits. And MailChimp's an excellent platform. I think DTO has a presentation coming up on it, and it's free. It was Canadian, but it's free for up to 2,000 unique email addresses if you have it. I use Chronometric for online booking, and again, a great platform to again introduce not only virtual visits, but also directing, also helping patients get onto Doxy, because a lot of the online booking reminders, you can put your virtual visit address on every appointment reminder, and the patient simply click on it to get there. And again, and websites too are excellent. Not everybody has them. It's not actually a requirement, but I find it is the most frictionless way for patients to get into my virtual waiting room. I just have to say what my site name is for my website, which is my name, and patients have to click on a button to their virtual waiting room, and they get seen to their appointment right away. The other one was great that the Doctors of BC are starting to do their public campaign, which mentions virtual visits, and that's great. And I'm starting to see it on Facebook, and I haven't seen it quite yet on YouTube, but hopefully it'll be there as well. Next slide, please.
Dr. Harrison, just going to get caught up on a few questions here.
Yeah,
There's
sure.
a lot of people asking for the details of the how-to, and that's I believe what Agata and Holly have been working on, is those how-to videos, which we'll have up on our website shortly, to really dig into the how to do this piece or that piece. And also a lot of people are asking, you know, what's the difference between this platform and that platform? That's something that the DTO can also help with. Dr. Harrison is working with Doxy right now, and I don't know how many other websites or other tools he's worked with, but he's certainly not an expert on all the tools. And this isn't about promoting one tool over another. It's about showcasing what Dr. Harrison is working, and we will also be showcasing other tools. There was a question though for you. Do you need a website? Do you have to have a website to do this? I think you said you just recommended it, made it a lot easier for you, but it's not a must, right?
No, it's not an absolute requirement. They're, you know, from posters, phones, emails, online booking. Those are all very good techniques and ways of getting people to get to your virtual waiting room. I just personally found that websites end up being the easiest way. And then if you want to do a little bit of digging, there are actually a lot of free ways of making websites too. But it's absolutely not a requirement.
Thank you.
Next slide. Now, in terms of, this might help in terms of a little bit of the how-to. So, and I'll do a little bit of demo just to kind of go through a typical workflow for my patients too. So that might help people kind of get the totality in terms of how to use Doxy. So that will be covered. And so in terms of the patient perspective, and these are some tips to try to make this as kind of frictionless as possible. So, and again, with all the ways we're advertising Doxy for telemedicine, make sure that you do write the address for your virtual waiting room. So Doxy will provide you a unique, I could call it a web address for your virtual waiting room, and you'll use that on all the different kind of media that you're using: posters, emails, phone messages, websites if you have them. And then on the first visit, make sure the patients start a little bit early. I normally recommend 30 minutes, and my staff tells my patients, try starting 30 minutes before your first visit. And that just allows people ample time for troubleshooting. And also, if they run into any problems, they can always come back to the office to ask the staff, and the staff can help them troubleshoot. But also, Doxy, the company itself also provides troubleshooting as well, either through little bots on the app that they use, or they can actually phone into Doxy, and then they'll actually get phone tutorials to help them troubleshoot, which is really quite nice. And the other one is also to remind patients to be patient when they're waiting in the virtual waiting room. Unlike when you come in person, there's no one greeting you. So in the virtual waiting room, just to kind of hold, be there and be patient, and someone will be with you.
Dr. Harison,
it's a little bit of courtesy.
Told the story of them logging in and logging out and logging in and logging
yeah,
out.
they do, because they don't know. They come into their waiting room and they're just unsure. I mean, they're just as, they're nervous, they're anxious, so a lot of people have never done this experience before. And so they get in there, they're like, oh, I don't know if I'm in the right place or not. And they leave and they come back. But I assure you, once they're seen, they actually find this like a really wonderful experience. And they're very grateful to be able to be seen, especially in this kind of, like this pandemic. It's a huge relief for people. It's unbelievable, actually. And then the other tip I don't actually have on here is because Doxy is actually being it's much more popular. I actually put after my name, it used to be just Dr. Harison's waiting room. I actually put in brackets now, Victoria, BC, because although there's only 2 David Harisons in BC, one's an emerge doctor that doesn't do Doxy, there's a lot of Dr. David Harisons throughout the world. And again, Doxy is, available to anybody on the planet. So it's always good to put a little bit of an indicator of, Dr. David Harison, Burnaby, BC, or in my case, Victoria, BC. So it gives them a little bit more confidence that they're in the right place. Next slide, please. Now, for the more on the physician and staff perspective, your setup, you can set Doxy up for your appointment in a variety of different ways, depending on what technology you have and what technology you like to use. So some of the physicians that use Doxy, they simply just use Doxy on their mobile phone, just to take advantage of that visual connection with their patients. It does have a little bit of a downside that if your EMR, your data, or whatever you want to share with your patient isn't handy on the mobile phone, it is a little bit difficult to share. When you use a computer only, depending on your size of your screen, it's great for visual and it's great for sharing information with patients, but often you have to leave your Doxy experience to move over to your EMR experience where you need a document. And so there might be a little bit of back and forth. And some people use a combination. So a combination of a mobile phone and a computer to document at the same time, or how I had it, I use a split screen on my computer as well. So I'll have Doxy on one side of my computer screen, and then I'll have my file on the other, and I'll give you a bit of a demo. And on the physician side, because often we're doing Doxy, sometimes we're leaving the talk to our staff or seeing another patient in person, refreshing the browser often or in between each patient will prevent you from having any glitches in terms of not being able to have audio or video on your subsequent visit. So I tend to refresh quite often once I leave my computer. And when I come back to my computer, I just simply refresh. One neat thing that I do for Doxy with my staff is what we do is virtual staff huddles. My MOA, she works out of home, I'm at the office, and my nurse often works out of home too. So the 3 of us are never in the same spot. So in the morning before we see patients, my nurse and my MOA, they all log in to Doxy as patients off my website. And then we actually hold a face-to-face staff huddle before we see patients. And then I can then share my schedule in terms of who's going to, like which patient is my nurse going to see, and then we kind of troubleshoot the day. It's a neat little trick that you can do with Doxy. And as well, I put my MOA on hold, and she's a patient, sits on hold all day, and then she's able to then message me through Doxy any kind of questions or concerns that she has about patients, or as she does our daily tasks. So it's really quite versatile. One thing I forgot to mention on here, oh, that's good. And then the other one is there's on the Pro and on the Clinic version, there's a way of locking. I would say one downside of Doxy is that it's outward facing, meaning anybody in the world, if they know what your Doxy waiting room site is, then anybody come and visit. So rarely does that happen. A lot less now that I put my address, Victoria, BC, on my Doxy wait room. But then the ability to turn on and off this passcode allows you to virtually lock your waiting room. So yeah, so I'd like to do a demo right now, just so that I can kind of demo a little bit of a workflow. And so it kind of gives some people from the audience or participants a little bit of an idea of what I mean by my workflow. So who's that handsome man? Okay. So most of my patients, they do access my my virtual waiting room through my website. And that's, again, doesn't necessarily need to be through a website. So it could also be those links that I mentioned before from email and from appointment reminders from online booking. But my patients go to my website and they simply just click on their video appointments. So the video appointments links to my Doxy account, much the same way a link from an email or an online booking would. And so this is your patient's experience. And so I will just, so as the patient enters, they simply write their name. I do encourage them to write their first and last name, and it's easier for me then to look at my day sheet and know that they truly are my patient. So, and they simply just check in. And when they check in on the physician side, Betty appears in the virtual waiting room. On Betty's side, which is this side, and this is what I mean, sometimes it's nice to be able to message the patients to say that they're here, but so your patient can message you back and forth from the virtual waiting room, and it just states that they're available. You can write, you know, a courtesy to them saying, this is your waiting room, this is my Victoria, BC, and and there's some messaging that you can have here as well. I talk about COVID crisis, and then here's the troubleshooting for the patient. So when I see the patient come into the virtual waiting room, I can send them a message. And normally I just, with the chat, I just say, you know, I'll be with you. And then in that way, at least the patient knows on the patient side that you're in the waiting room and ready to be seen. And when I do want to see the patient and start the call, I just simply hover over it and say, start call. And
Dr.
then,
Harrison,
yes.
I can't remember if you're going to cover this next, but how do you handle consent? And I know it can be done 101 different ways depending on all the mixes of different systems. But how are you approaching that with this version?
Consent, and actually this is based on the advice of the DTO, is I ask for verbal consent. And DTO actually provided a nice little script for physicians just to follow along, and that's what I actually honestly I use. It's a verbal consent, and then in my EMR, I do have a little bit of verbiage that I use.
So I didn't pay them extra to put that plug in for the DTO, but if you go to the Doctor's Technology Officer, the Doctors of BC website, you'll see those tools. There's also a one-page consent form there, and that blurb. We'll send it out to everybody so that you have the full support suite, so that you don't have to go digging for it, but it is coming up here. People are asking, so thanks.
Yeah, so again, so I use, so I use MedAccess, and so this is, I just have a little script that I use for every patient that comes in. And this is the verbiage right from the DTO. And I do verbally explain to patients, you know, that it's secure, that your information isn't stored on a server. And so, and again, that this, you know, we do our best in our current environment in terms of telemedicine. It doesn't replace physical exam when it requires physical exam. So I cover all that. Again, but I do that verbally. So
I just want to do a check with Dr. Reddy. I see he might want to answer a question live, but just want to make sure. He might have just been a keener and clicking buttons.
Yeah.
Dr. Reddy, did you have something to add?
You caught me. I'm a keener.
Okay,
Oh.
good enough.
And then, yeah, so maybe I'll leave it in this view, but on the next slide, I'll just say how I do and how I handle people who are late. So if people are late or I don't see them on the day sheet, but I see Mo or Curly on the day sheet, or I should say into the patient queue, I simply just move on, right? So, but for the patient that's late, there are two features, and you can do an invite either by an email if you have the patient's email address, or you can text them. So the email does allow you to put in the person's email address, and then you can send a message. And that's through the Doxy site. And then again, it provides a link for the patient to click on to get into the virtual waiting room, or by text. And I don't know how they pay for it, but that you can put in anybody's phone number anywhere around the world, and then they will text that individual. Again, it'll send them the location for their appointment. They just simply click on it, and then they enter into the virtual waiting room. So great thing about virtual care is your workflow and your work is steady. So if someone's late, you just move on, and you just carry on with your day. I do find with virtual visits, you do have to be a little bit more creative, because everything, again, it's all communication, it's verbal and visual. But I've been using more remote devices, so patients are now, everybody has a thermometer now. Everybody has a scale. People with blood pressure issues have blood pressure monitors if they can afford to. Patients send in pictures of rashes by email in advance. You can also do photo capture, but I find the quality isn't as good as people's smartphones, and they can email it to me, or videos. I had a mom bring in a video or send me a video of a child that labored breathing. It was great. And I can also saw them as well over telemedicine with labored breathing. It was great. And the other thing that you do need to do in virtual visit, which is a lot different. I guess we can just stop the share right now.
We'll pull the slides back up.
Yeah, pull the slides back, please. Thanks. Yeah, and we probably have to go to the next slide too. Is that we do have to, yeah, the next slide too would be perfect. Yeah, we do have to gather additional information. And that other additional information are, what's the patient's pharmacy? What are the patient's lab and imaging locations, which are fairly close, right? So those are the things that you need to gather. Because everything that is now virtual, we no longer have the luxury of being able to print something out by paper and then handing it to the patient. So the final part, or the follow-up, I find is the most tricky. But with Doxy, you can do a file transfer. Didn't show you, but DTO does have videos on it. But you can fashion up your lab and X-ray requisition, and you can file transfer it to the patient if you lack e-faxing. So, and next slide. And so I think this is my final point of the presentation before we start opening it for questions, is that telemedicine doesn't necessarily mean working remote. And there's a big difference. So working remote means you need to have an EMR with remote access, being able to work from home. You need mobile phones rather than hardline phones and VoIP app phones, e-faxing, scanning, and online booking for patient follow-up. But if you don't have these, doesn't mean you can't do telemedicine. So it just might mean that you just have to think about your location a little bit differently. So and so if you can't work remotely, I would recommend still work in your offices. So, because in your office, you have all your usual clinical workflow that you're well supported. So if by telemedicine, if it results in a prescription, you can still write out the prescription. Now you've asked where the pharmacy is, then staff can then fax it to the pharmacy for the patient. And same with lab requisitions, and same with imaging recs, particularly X-rays. One thing it does do, it does put a little bit more burden of work on your staff. And again, that's the reason why you really need to get staff buy-in, because you will find if you don't have e-faxing or the ability to work remotely, it will be more of a burden of work on your staff. And that's something that's unfortunate, but something that needs to be said. And then again, with the help of DTO, consider implementing more remote solutions into your practice in the future. So working remote has many advantages in terms of not only in terms of accessibility, in terms of pandemics, whatnot, but it does make your practice run much more efficiently. So that is the last piece of message for you. And
I believe you were doing
yeah.
forwards after or before this happened as well, right? You and your MOA were leveraging this so that she could leave early, I believe was
100%. Yeah. So, I mean, virtual care is my MOA. She has young children and she has to leave early to pick up her kids from care, and she has to travel a fair distance to be able to do it. And so what I was doing at the end of the day for 2 hours, I was doing phone call visits for 2 hours to finish off my day. And so when Doxy came across, and particularly it was the ability to share my screen with my patient, was the thing that really hooked me. Because without the ability to share your screen and share the information, telemedicine is a phone call, right? So you need to have that extra visualization of the patient, and then particularly information. And a lot of other telemedicine solutions don't have that capability.
Thank you. And I know you were leveraging that well before this all came upon us. I just want to check in with, I'll start with Dr. Lin, if you want to add some comments to this slide and how you've been using telemedicine and the workflow as well. Dr. Lin?
Thank you, Dr. Harrison, for your presentation. I also have a website for my clinic, and we take the patient's consent as a electronic signature on our website, and they submit that as a Google form. So that's another way that you can think about consent. And our MOA puts that consent into their EMR, and then we don't have to ask again for the same consent. Besides that, my workflow is quite similar. We have booked appointments for our patients for their telemedicine consults, and I don't use the screen share as much. I would probably start trying, because that sounds quite interesting.
Thank you, Dr. Lim. And Dr. Reddy?
Hi, thank you. And thank you, Dr. Harrison. It was a great presentation. I think much like most of my colleagues, I was dabbling with telemedicine before the pandemic. So pre-pandemic, I was doing about 10% telemedicine, mainly for those exact reasons that Dr. Harrison said. Those patients who were working and couldn't come in, and also patients with agoraphobia, mental health, etc. I was running it during lunchtime for my patients mainly who worked, and it was working really well. I was capturing conditions that would otherwise be lost to walk-in clinics and providing, I felt, better longitudinal care pre-pandemic. And then once the pandemic started, we suddenly had to switch from 10% virtual to almost 100%. And so the workflow has changed in different ways. Currently, I do have my EMR open in a split screen, which I find invaluable. And I see there's a question there about how to do it. So I think that's a good thing to do and to answer. And I'm hopeful one of Joanna, etc., will be able to do it. But having your EMR open at the same time as your Doxy window, web browser window really helps capture the workflow in real time. Also, I have booked appointments. The staff is essential to making sure that this works. So a patient would phone my office, my staff member would explain that we've moved to virtual care, run through the process of logging on and hand-holding some patients who may have some trepidation around using it, book a time. She would then be logged in as me. I use the professional version. She'd be logged in as me on her terminal, and she'd be sending them text message reminders or invites at the time of their appointment. The patient will click on, and I'm in my office, because I'm still running an office for those patients that absolutely have to have physical examinations, because we're still on call for a large group of physicians. And so I see about one person who needs an exam, but the rest of my day is all virtual. And there's been a mixed review, but I think the best comment today I had was a patient who said to me, "Thank you for maintaining access during the pandemic. You've had to rejig your office." And it was, even though I've seen so many patients, just that one comment is really validating that the appreciation of having that connection still available was very important. Thanks.
Well said, Dr. Reddy. And thank you both of you for joining as our panelists. It's Bridget Matler here at the Doctor's Technology Office. We are going to, if you want to put your hand up, you're more than welcome. We can get you off mute. That is the end of our presentation. So if anyone has to leave, you're more than welcome to drop off, but we will stay on the line. There are a few questions on the board, and Dr. Harrison, you're getting lots of fan mail about your split screens. So while we get the first person off of mute, would you mind just showcasing how you're able to do that?
Yeah, sure. So it's how I do my split screen. It's because I use Google Chrome. Google Chrome has a really neat feature, is that this little green button up here allows you to go full screen. But then it also allows you to go, instead of full screen, which is the, obviously the full screen. And then it actually allows you to go either left or right. So I can just say this screen is the left. And then I literally just click on this one and boop, there you go. There's your left-right screen. And so it's actually two browsers that are now welded and wedded together. You can change in terms of the size to it. But then I have my Doxy on one side, and then I have my EMR on the other side. And so I'm documenting on this side while I'm doing my virtual visits on this side. It works particularly well on this iMac. So.
Okay, so it might be because it's Mac.
Yeah, I know.
I'm not sure if it's a Chrome thing. I think it's a Mac thing.
I was going to say that looks an awful lot smexier than what happens on my computer, but I can ram it in there by using a split screen.
Well, yeah, it's certainly Chrome, but it's Mac version for sure. Yeah.
Thank you very much.
Yeah.
Kelly, we're just going to get you off mute.
Yes, hi, Dave. Thanks so much for the question, or for all this information. My question is, how do you share files from within your EMR, say lab results or things like that with your patients?
Sure. Let's go back to Doxy again. So for this, and I guess everybody can see me, right? Is that okay? Everybody can. And so let me see if I can find where Mo is. Okay, so I've got Curly here. So what we'll do is, yeah, you have to turn off the, I don't want to, feedback's terrible. Okay. And so when you want to file transfer to a patient, it's literally like we did screen shares. You hit the file transfer button. And what it'll do is a window pops up and asks you to select a file. So you can either drag or drop if you have a file sitting there on your desktop, or you can select a file to share. And then when you select a file to share, it's probably going to pop up. So it pops up on your window, and then you can transfer any file, but generally what you're doing is you're transferring a PDF. You select the PDF that you want to share. I think this is a fillable COVID referral form. You hit open, and then on the patient side, the patient simply hits the download button. In my case, it's going to make a copy, so it's going to download the file back onto my desktop. But for patients, it's going to download on their cell phone or on their computer. And then and then you can close it on your side once it's been successfully transferred. But it's sitting there on the patient's desktop for them to then open and then to print off. And so when I see patients, when I'm in my EMR, I'm generating a requisition for them. Then I save, instead of printing to a piece of paper, I print a PDF. The PDF then is on the desktop, and then I do the file transfer as I demonstrated.
Dr. Harrison? Go ahead, Kelly.
This would work then with a secure computer in your office. I'm wondering about the security aspect. If you're at home on your laptop, you're taking a PDF out of a secure program like MedAccess and putting it on your own computer. That seems like that could be a problem.
It'll be a problem if you leave your computer alone and someone can, you know. So it's a physical security issue, right? So depends on how you set up your computer. So on my computers in the office, if I'm not typing for more than 2 minutes, it goes to a lock screen. And then it's secure that way. Especially if you're working in multiple physician offices in the first place, it's a good idea just to make sure that feature is on. Because if you walk away from the computer, then it's left open. You do have to, at the end of the day, any confidential documents, you do have to clean up at the end of the day. As soon as I file transfer, I put it right into the trash can and then I delete it. And it's off my desktop.
I think right now a lot of doctors have a lot of workarounds. Would you speak to Dr. Harison around wet signatures and how you're getting around that? Maybe Carol, at the risk of getting fired, maybe you could speak to that as well on the updates that we've gotten at the provincial level around using wet signatures and using these workarounds as well. Dr. Harison first.
Unfortunately, I'm not the best person to talk to this. I have e-faxing. And so I don't do any signatures because it goes straight from MedAccess to the pharmacy. I haven't had any pushback from any of the pharmacies to requesting a wet signature. So, and when it comes to duplicate prescriptions, I'm signing off on them. I'm scanning them, sending it to the, well, that's a good question right there. So yeah, for duplicates though, I do sign off on them. I put them in a scanner. I fax them over to the into the pharmacy, and then I mail it afterwards. So I don't know if that answers the question or not. But.
Carol?
Hi. So we have been working with the College of Physicians and Surgeons as well as the College of Pharmacists. And really the issue about wet signatures is not really about how to transmit the prescription or the lab rec or whatever. It's mostly around prescriptions, but it is about identity management. They need a way to validate that they're receiving a prescription from a licensed physician who is caring for the patient. And so after going back and forth, of course, you all know that you can phone in a prescription. You can still fax a prescription, and some pharmacies will be more stringent about this than others. But so long as you put your college number on there and your, name, address, and a contact phone number where you could be reached if they have questions for you, they will accept a fax. But the preferred method is actually e-faxing. So same thing applies. So if it's going directly from your EMR into the pharmacy fax number, they still want to have access to your college number and a phone number where they can reach you. And that's where we've landed as of today.
And on Oscar, because I use Oscar, on Oscar EMR, you can put a unique wet signature on every prescription. So if you use Oscar and you don't see that function, you can talk to your OSP. They should be able to put in a notepad next to your prescription where you can draw a new signature every time you write a prescription.
Oh, that's great. I think more of the EMR vendors are starting to allow that wet signatures, or at the very least an electronic signature, so you can include that as well.
Love you. Thank you so much, Carol, for chiming in on that. As I said, lots of workarounds, lots of the different EMR vendors doing things. And Doctor's Technology Office also has an e-fax guide. I believe that was just published today on our website. We'll make sure everyone gets a copy of that as well. So we've got time for about one more question, and then we'll let everyone else go. But as I said, we'll stay on the line for an extra 20 minutes if need be for some one-on-one time. But does anyone else would like to get off mute? Just put your use your hands up button so we know it's you and we can pull you off. I don't see any more hands up, Dr. Harison, but there is a question here around, has there been a big change in your income? And I guess this is pre-COVID, but when you were starting to do a lot more virtual visits, the billing has changed. There is a billing guide again on the Doctors of BC website. which you'll get a link to. But I know a lot of the billing and the changes in income have been a little bit of a trepidation point for some physicians. Would you be able to speak to that?
Sure, I love to speak to this point. It really depends on your patient demographics. If you have a young patient panel, it works out financially much better because an O100 is what, $30.15. And so you're getting $34.44 with a virtual visit. If you have anybody over the age of 60, so virtual visits remunerate less, right? So than a 100. So if your population is older, you're going to earn less for visit to visit. And so, yeah. So I don't know. You tend to see or able to see a few more patients per day, so your volumes are a little higher. So on balance, I'm earning about the same because I have a fairly balanced practice from tip to tail. So I haven't seen too much of a reduction, but you do miss out on physicals. You do miss out on your procedures, which are a big hit too. But thankfully, with the new billing changes as well, you can still do the 14033s, which is great. And so you're not going to lose any of your incentives because you're still paid to have those conversations, which are great. But for the 100s, and I would say for the 120s, because there is a fee code for virtual care. So it's the 13038, which does, again, bills more for people under the age of 60, but bills less for people over the age of 60. So it really depends on your balance of your practice.
And I will add to that, during this time, if you don't do virtual care, you're not going to see that many patients in person.
Earning zero.
So I think for the next month or two, I think this is going to be crucial for the billing amounts.
I think this is going to last more than a couple months, so this is going to drag on into the summertime, I fear. So if you don't do virtual care, yeah, your earnings are going to be, zero. So
I completely agree with both of you, and I think unfortunately I'm in the group that has the majority of my patients over 60. But what I find helpful is it's given me more time to work on panel management, and I'm actually able to access those incentive billings in a better way now, because I can actually reach out to the patient and then do the virtual visit and still capture all my incentive billing.
Oh, that's very true. I have a nurse in practice, and that's what her role is. So her role is to reach out. And while I took the advantage, now everybody's all, they're all self-isolating now. So everybody's home. So I'm like, well, this is a great time to hire my own nurse in practice to work fee for service. And we're just picking guidelines, and we're just going through all the guidelines, and she's phoning people, and we're catching up on all of my panel management right now. So it's been an absolute godsend in that way, because it actually helps me kind of recoup what I've lost when it comes to procedures and some of the full physical billing. So it's been great. So it's great for panel cleanup right now.
Thank you. All right, we're almost at time. I'm going to start wrapping us up. There are some online videos that will be shared with you that really in-depth, more detailed videos, very quick ones, I think under a few minutes each, that you can dive into. We'll make sure you get a copy of those, and they'll be up on our website shortly. We also have an MOA and physician peer network. Dr. Harrison is actually one of them, and we pay the peers to go out and help and support you if you need more one-on-one support. So if you're just still feeling a little bit nervous, do reach out to us at our DTO info at Doctors of BC, and we can help you out with that. The Doctors Technology Office team, which is in your panelist list as well, are also here to help you. And if you're having any technical issues, or you're need a little bit more coaching, or you have some questions, please reach out to us. We don't always have the answer, but we will try to investigate for you and find out who can answer it if we can't. We will send a follow-up after this session. You will get the video, the recording of today. You will get the slides as well, and we will be posting this provincially. So stay tuned for how many hits this gets, David. And if you have any ideas or thoughts or other things you'd like to see us do, this one was on Doxy. We will be doing other tools. There will be quite a bit coming up after the team has a break over the Easter weekend, but we have some ideas on what else we could tackle, and we'll make sure that we get those out to you as well. So we hope you found this us helpful today. Special thanks for the very late evening for Dr. David Harison, Dr. Reddy, and Dr. Lynn, and to the Doctor's Technology Office team that stayed on the phone late, Astrid and Shell especially, our admins that help support this technology. I hope this was helpful, and please join us when we have new sessions coming up, hopefully in the next week or so. Thank you, everybody. And again, I'll let everyone go, but we will be staying on the line. So we'll just go quiet for a minute to let everyone have a nice clean break, and then we'll come back on and we can answer some more one-on-ones if you'd like. Thank you, everybody. Have a good night.
Good night. Thanks for having me.
And Kelly, you might be muted on your end, but please go ahead.
Yeah, hi. Wow, that was awesome. Seriously awesome. I'm so impressed by all of you. You guys just, that was so well organized. Awesome demos, like just wow. Capital letters, exclamation marks, all that stuff. Okay, so one of my questions is for anyone or everyone. I wonder, especially Dr. Harison, if you think there are features missing in Doxy that you, oh, it'd be so nice if it had this or that. So that's my question. Thank you.
Yeah, well, that's a great question. As a bit of an IT nerd myself, you know what? It really hit all everything that I wanted to have in a video app. I had the privilege. No, it's just briefly saying I had the privilege of demoing or seeing the demo of the TELUS MedAccess offering in the fall, and everything, you know, and that I was like, oh, it should be web enabled so everybody has access, and you should have file sharing and blah, blah, blah. So I went on and talked to TELUS and said, these are all the features that TELUS should have on it, which they ultimately didn't do. But then I was shown Doxy shortly afterwards, and I'm like, well, that's the thing that I actually want, because it hits all the high points. You know, so I mean, you know, what else can you want except for having the patient in front of you? Maybe it should have a teleporter. I don't know.
Yeah, that's great.
Yep.
That was a good question. Actually, I always like
It's a
that
very
question.
good question.
Yeah.
It's a very
Yeah.
good question.
What would you change if you were to go back?
Yeah.
Yeah,
That's a
and
great
curious, Dr. Harison, how long, you seem quite savvy with using Doxy. How long have you been using it for?
I just started using it in just in November. So one of my clinic mates, he's involved with the Data Health Initiative, and they had done an analysis on telemedicine at the time, and he just showed me, and as soon as I saw it, I just fell in love with it. It's one of those things that just kind of clicked. It just hit all the high points, all the things that you would need to do to deliver education. So my background, again, is academics and education. So it really reminded me of Google Classroom, right? So, and it had everything except for, it has HIPAA compliance and it doesn't store data. So that's what you need. So and then as well for Doxy, it's a nonprofit organization, which kind of rang as well to me too. So, and their vision and their mission were excellent in terms of providing telemedicine and healthcare access for all, right? So it just, yeah, it really resonated with me. So.
Yeah, I have a ton of questions, but you know, I'm going to limit myself to one more. You mentioned the academic background, and I'm privileged enough to work with medical students. Mm-hmm. I am curious if there's like a way to integrate teaching into the platform. For example, can a student be in the background or on another screen participating in a Doxy session? And I will stop there because I know there's a lot of people.
Oh yeah, that's a great idea. Because you can technically, right? So in Doxy, it's a group call version, if you will. And what you could do is you can have a patient, and you can also have your medical students both sign in as patients, and then you would do a group call. You just call the patient in, and then you would call your medical student in, and then all three of you can have a visit. So you can use this platform very easily to do group medical visits.
I have to keep reminding Dr. Harrison that that might be a paid version.
That is, sorry, that's the pro version. That's certainly the pro version. Sorry, not the, yeah, so not the free version, but certainly the pro version, yeah.
Your panelists are good handlers for you.
Yeah, they are. They're very good handlers.
Keep you honest.
Yeah.
Does anyone else have any questions? I have a good one for him because I've heard him speak to this before, but if nobody else has their hand up,
Oh,
Dr.
we just got one more. Lizzle, if you want to go ahead. Lizzle Sullivan,
She's muted.
you might be muted on your end.
There
There you go.
Thank you. I was just asking, Dr. Lin mentioned something about an electronic signature for the consent forms that can then be downloaded into your EMR. I didn't really understand how that worked practically, and I wonder if someone can explain that.
Right.
Dr. Lim?
I can explain it, but I can also show it. Let me see. All right.
We would have to
Okay.
stop our screen share, Anshel.
Yeah, Anshel, can you stop the screen share?
And Dr. Lim,
Wait.
you're now a wild card because we didn't practice this, so you have to do the screen share at your bottom. This is why Carol pays me the big bucks, right?
I feel Zoom stocks increasing as we look at
I don't
this.
know. Zoom has some bad rep. I don't know.
Yeah,
I don't
yeah.
know.
Let's not
so
open that can of worms.
this is my clinic's website, and this is our spiel on telemedicine, and these are our links. Can you guys see it?
Yes.
Yeah.
Okay, perfect. So here is just the electronic consent, a link directly from my website, and then they'll fill in. It's basically an adapted version of I think CMPA,
Right.
and then they just put a signature here and they hit submit, and then my MOA gets a notification that there is a new consent, and they will go through and they'll actually walk the patient through. They'll send an email to the patient saying, "Oh, this is the link, and this is how you schedule an appointment," and that's how they get started, and that's the electronic consent form. This is a Google form. It's free, and anyone with a Google account can make one.
Dr. Lim, would you go to the bottom again?
Yep.
How do you sign that? With a mouse, your finger?
No. This is the electronic signature, so I'll just sign it, Shen-Ping.
Ah, so you just type it in. Okay, thank you.
Yeah.
Okay, thank you. This is
That's
great.
very cool. Yeah, that's good. The pro version and the clinic version, Doxy is working on a consent form as part of the workflow. So as patients enter into the virtual waiting room, if you're on the pro version or the clinic version, if you wish to have consent, there will be a dongle that you'll flip and you'll be able to have it. So it's coming soon.
Hi, this is Carol Rimmer from Doctor's Technology Office. I have heard that Doxy is working on one, and because we have so many clients in BC, they have offered to make us a specific consent form for BC physicians. So stay tuned.
That's fantastic news. This is Devan Reddy here. I actually have the consent form in my waiting room while the patient's in the virtual waiting room waiting to see me. And when I get onto the call with them, I really ask them, have they seen it, and get verbal consent.
Right.
I believe the free version will allow you to put all that text in virtual waiting room while they're waiting to see you.
Thank you. Any other questions? We've got about 16 people left on the line. I'm not sure if you're here by accident and just haven't logged out, or if you're really curious about some of the questions coming up. Question for Dr. Harison, Reddy, and Bill, and Dr. Lin to sort of wrap up the day, but most memorable virtual visit with a patient? No names.
Oh my God, where do I start?
I just had one. I think I accepted the visit before her appointment, and she was in the washroom, flushing the toilet. So that was kind of funny. I think I was just early by a minute, and she was a little bit compromised.
Good Lord.
Let's see. Well, I've got two. One of me and one of my the other physicians that work in the clinic. And so we'll start with the other one, my clinic mate there. And so he was sitting there having, he has a setup and everything. This is before COVID and everything. And so he's sitting there having the appointment, and then she stopped mid-sentence. And this was told afterwards because he was wearing his headphone, because he just starts busting out laughing. But I guess they had the entire appointment, and then in the middle of the appointment, she said to him, it's like, so how am I going to have my PAP done? So that was a good one. And then for me, the other one is like, again, one of my patients, he's a little bit of a joker. He's a great guy. I'm sitting here talking to him, and I'm like, that looks like bathroom tile behind you. And then I'm like, geez, that audio is really echoey. And I mean, we had the entire medical appointment with him bathing. Couldn't believe it. I'm like, I didn't say anything. I wasn't going to put myself out there, but oh my God. Yeah, it was pretty fun.
That's incredible.
Are you partners with Jaron Easterbrook?
Oh yeah, I am partners with Jaron Easterbrook.
I know Jaron well.
Jaron has some good stories too.
Yeah,
we had quite a bit of fun in Victoria when the doctor started sharing stories. All right, everyone, last chance, going once, twice. If you want to have a quick chat, again, Dr. Harison, Dr. Reddy, and Dr. Lynn are available as peers. We have about 80 actually other peers, MOAs as well. If you have an MOA that needs some help, reach out to us and we can get you some help for that as well. Anyone else? Last chance? No, we're good. Well, thank you so much. Thanks for spending your evening with us. We do appreciate it, and we'll edit out the last part. Thank you so much,
Harrison, and thank you, Bridget, for hosting.
All right, everybody.
Okay,
have a
good night.
Okay, have a good night,
Astrid.
everybody.
Thank you, Anshel.
Thank you very
thank
much.
you.
It was great. Thanks.
Thank you so much.
Okay.
Thank you.
Right.
Thanks,
Thanks, guys.